So now we're going to meet three people who do something a little different in this space. And I'm not going to introduce them with all of their credentials. Rather, I'm going to ask each of them to do what our industry colleagues did. What do you do in this space? So the first of our speakers in this segment will be Laura McCleary, who's from the Center for Science in the Public Interest. What do you do, Laura?
Well, hi there. I'm Laura McCleary, and I'm a lawyer. I've been doing public interest advocacy work, mostly in the public health and good government spaces for 18 years. And Center for Science in the Public Interest is an independent, by which we mean we take no government donations or industry money, nonprofit organization. And actually, dietary supplements are, I would say, a very small part of our overall docket. So, here's a snapshot of some things that we do. Really, we are an innovation lab to push for public health transformations that drive change. So, one of our achievements is coming to a restaurant near you, or has as of several weeks ago, calorie counts on menus. That was really an effort that was led by us. The ban of trans fat from the food supply, and first its labeling, was an effort that CSPI helped lead. We led the fight for healthier school meals for children, for school children. And we use a mix of tactics and methods to achieve the changes that we seek, everything from regulatory involvement to litigation in the courts on class action claims around false and misleading products, to legislation, and of course public education. A centerpiece of our work and our independence both is our Nutrition Action Health newsletter. This is a 10 times a year publication. It's very affordable. I commend it to all of you. It's a terrific magazine. Really reviews with rigor the science behind a lot of claims that float around in the food, health, and nutrition space. And over the years, we've done a lot to debunk and analyze the effectiveness of various types of dietary supplements. So this is the work that I draw on as the regulatory lawyer, thinking about what things we should bring to the public's attention, which things we should bring to the Food and Drug Administration's attention about supplements. One of these, diabetes defense, I'll talk about this a little bit later, but it's, in the area of unapproved drugs, we have particular concerns. So if there's a claim being made that a supplement counters the symptoms of diabetes or prevents some aspect of diabetes, we are going to take a particular look at that. Most of the studies you'll see in this, if you can't read it up here, you have the slides in the booklet, were actually underpowered to the outcome or found no effect. And you do see these kinds of stories populating the web. In particular, cinnamon has magical properties. I think a lot of this is that there's a lot of magical thinking around food in general, and dietary supplements in particular. We also tend to look at particular claims. So the example in the other article on Prevagen, for example, the company touted the study but failed to disclose that the placebo was equally effective. This is not unusual. There's often slim or no evidence behind many of the claims, and it's tricky from a regulatory perspective because the Office of Dietary Supplement Programs does attribute claims that are around an article, a product that's being sold like as a supplement, as imputed marketing. But oftentimes what you have on the shelves are, given that companies have gotten very savvy, is you'll just have the bottle say St. John's wort or cinnamon capsules or something, and there's no claim at all. And so therefore the consumer is then vulnerable to reading about on the web some separate marketing material that's off the label that may tout the benefits of a particular substance, and yet it's very hard for FDA to make the enforcement case against the company. This is another example of 2 Nutrition Action Health newsletter articles that we published on testosterone. It's a 3-page article. If you subscribe, you'll get access to the full thing, but the upshot was that while low testosterone is a legitimate medical condition, of course, that needs treatment in some cases, that it's being oversold, and that actually taking excess testosterone raises the some risk of cancer. It's not totally clear. On the probiotics, the recommendation that came out of that was that they're oversold, they don't need to be taken daily, they can help with particular conditions, and there's usually strains that have been identified as helping with particular things, like while you're taking antibiotics or if you have some kind of other infection, and so you can take those particular things, but that a lot of probiotics offer scant or little benefit, maybe 1 day less of a cold, for example. I got involved personally in dietary supplements with a very dramatic case. I read in the news, dietary supplements had been part of my docket, but in addition to sort of Nutrition Action doing these publications and the 2013 Durbin bill that we had been involved in, as well as the industry, and trying to push for product registration, this issue came up in the news, and I read the headlines just like everybody else, and I became immediately very concerned that pure, powdered, or in some cases highly concentrated liquid caffeine was being sold on the internet. It was sold at 99.9% concentrations, a tablespoon in 5-pound bulk bags or 2-gallon jugs, and a tablespoon could kill an adult. A teaspoon could kill a child. The proper dose was a 32nd of a teaspoon, which no one has the ability to measure at home. And so we wrote a citizen petition and submitted it to the Food and Drug Administration. These 2 young men are Logan Steiner and James Wade Sweat. We worked with their families who came to Washington on their own dime on multiple occasions to meet with lawmakers and publicize about the issue. We had press conferences on the Hill. The FDA initially issued 5 warning letters to companies that we had identified as selling these products. We did a spot check of the market within like 6 to 9 months later, I forget exactly the timing, and there were still multiple availabilities of this product on the internet. You could just get it. So we ordered the product, we took it up to the Hill, we had this kind of show and tell with reporters that we could still get these products even though the FDA had issued a warning letter. There was also a 3rd death that showed up in the medical literature where a person had taken, a man had taken the caffeine and thrown it up all over the dashboard of his car and went into cardiac arrest, which is how you die from a caffeine overdose. And there may have been occult deaths that were showing up in the medical literature because if you take a high dose of caffeine and then are going to exercise or jog outside or something, and no one connects the substance with the heart attack, if you had a normal autopsy for a heart attack, you wouldn't be looking for caffeine levels in the blood. So there could have been heart attack cases related to these products that just didn't show up because no one did a second autopsy specifically looking for caffeine levels. Just recently, in April 2018, we were so heartened to see that the Office of Dietary Supplement Programs actually put out in a final guidance that these products are illegal or adulterated per se because they're if they're sold in an amount that's lethal to the end consumer, if they're sold in bulk, that even a scoop, like a little scoop that came with the bag, which is how they had been continued to be sold, they said could be separated from the bag and would pose a danger. And that's true. Logan Steiner's friend gave him some of the powdered caffeine in a little baggie separated from its original packaging. So once these things are in circulation, it's very hard. And I think the trend is very concerning because what it shows is that there's a lot of bulk supplements that are kind of inputs to formulated supplements by the major brands and companies, and those you can purchase directly from China or through bulk supplements websites here in the US. and basically you're dealing with raw ingredients and their uncut form. And so, this is the FDA kind of pushing back on the ability to turn around and then make a profit by selling that. We also, in December, put out, and as I said, we're very concerned about unapproved drugs, things that are marketed essentially to treat disease as dietary supplements. And FDA has a guidance that says that they're going to prioritize enforcement of unapproved drugs because they pose as legitimate treatment for a medical condition. In the case of opiate addiction, there are medically approved treatment protocols that are known to be effective for that condition. Few people have access to them. Some may not even know about them. And so the temptation to then go to use a dietary supplement or not to have to go to a doctor that might be affiliated with your employment and admit to an addiction problem is very high. So into that gap have rushed a number of, as Duffy would say, bad actors. These are companies that were marketing opioid withdrawal aids in the dietary supplement marketplace, some of which were sold on Amazon or eBay and other places. We wrote to the companies, and when I say we, I mean the grander we. David Sharp, my colleague, wrote them letters. As CSPI, do you have scientific studies showing that any of the ingredients in these products are effective for opiate addiction relief? These are the responses we got back. Scientific studies are very costly, so no, we didn't bother. We don't really have any scientific studies as such currently. These are, very common for the bad actors within the industry. I would agree with the characterizations that there are better and worse companies in this space. The problem is that the worst companies create an atmosphere of consumer confusion and fraud, sometimes outright fraud. In January, FDA and the Federal Trade Commission, which we had also written to about the illegal marketing of these products and which has already brought several cases on the opioid dietary supplement claims, took action. We were pleased to see that they went out into the marketplace and found additional bad actors that we hadn't uncovered in our initial research, and they issued a number of warning letters to those companies. So that is the first step in an enforcement action. I assume that the agencies will follow up and see whether, in fact, the companies have ceased selling those products. In some cases, the Department of Justice or FTC may go after the companies and seek aggressive kind of consumer penalties and even repayment of consumers who were defrauded. Obviously, with a condition like opiate addiction, it's life-threatening. With other products, what we see is that there's just widespread economically motivated adulteration, which is lawyer speak for fraud. In the case of Ginkgo, we noticed that there was an industry monograph pointing to widespread adulteration of Ginkgo products, which is one of the top sellers among dietary supplements, and that there was strong incentive to substitute other parts of the Ginkgo tree or buckwheat for the allegedly active parts of Ginkgo. It's not a great supplement to begin with because there really isn't good evidence that it's effective for many of the things that patients may take it for, like memory loss or muscle and joint benefits. So we wrote FDA an enforcement letter saying these are adulterated. It's kind of like that joke, the food's terrible and there's not enough of it, right? These are adulterated and they're kind of ineffective. So some of those things led us to a recommendation to consumers to avoid ginkgo biloba supplements. Our priorities when we think about advocacy are first that we need to protect the public from acute risks like pure caffeine. We have also worked on the tainted supplements that are, tainted with often performance-enhancing amphetamines or that sort of thing for weight loss. Or from drug interactions, we have a long-standing citizen petition to have a warning label on St. John's wort. We're going to ask for the same thing on beta-carotene because these have known drug interactions. We also are concerned about unapproved drugs. And then as a secondary concern, we work on things that are about efficacy, where we think consumers are being misled by an avalanche of claims. These are a number of really in the weeds kinds of reforms, but basically they add up to, we think there should be some kind of mandated third-party pre-market oversight of safety and efficacy. We recognize this is a fight that we lost in 1994. We think it's worth having another conversation with the industry about whether consumers and the industry really benefit from the current Wild West regulatory environment. We also would back a registration system. We think FDA needs more resources, such as user fees, and that in a number of areas, FDA should enhance its regulatory oversight, such as for new dietary ingredients. That's the new dietary ingredients guidance. In addition, we think there should be a requirement for substantiation of claims, that things are effective for the purposes claimed, and that would sort of get out of the conundrum that Duffy had laid out, which is how do you claim that something doesn't make you sick? And that there should be ongoing prosecution where things actually pose a hazard. Thanks so much.
Thank you. Well, I could use that. Well, thanks very much, Laura. Todd Cooperman is from consumerlab.com and has been a regular on our program for quite a number of years. The only thing I need to watch out with Todd is that he always has so much he wants to say. So I won't take any of your time as long as you promise not to take any more time than anybody else.
I'll try.
All right.
Thank you, Paul.
I'll help you.
Thank you. It's always a pleasure to be here, and thank you, Pauls and Louisa, for having me, and ODS. I will try to get quickly to really where I want to go, is to talk about some of the interesting things that we have been finding at Consumer Lab. For those of you who are not aware, Consumer Lab has been around for 19 years. I'm the founder of the company. We are basically people out there testing to see what's really in supplements and other health and nutrition products. And it's nice to see how the baton gets passed sometimes to the people at CSPI. We actually found some of those problems with the Ginkgo, which were cited into the policy work that CSPI is doing from time to time. Again, I'm going to try to skip through some of the earlier stuff. Since 1999, we've tested over 6,000 products. We put out a report every 3 weeks on another category of supplements. We have about 5 or 6 categories always in testing, and that represents about 850 different brands of that we've tested from. And we're supported primarily by 77,000 plus individual subscribers, plus libraries and other institutions that subscribe to Consumer Lab. It's $42 a year. And also, if anyone's not a subscriber, I'm happy to give you free access for 3 months. We're going to pass around a sign-up sheet, which is what I do every year, and we're happy to extend that to you. We're in the news a lot just because our findings are quite interesting to a lot of people. Again, I'm the founder. I'm an MD. Our head of research is Mark Anderson, who spoke here last year, 22 years experience in the dietary supplement area himself, and an active member of the AOAC, involved in developing protocols for testing supplements. Why can't we just rely on the FDA and good manufacturing practices with supplements? Well, as you've been hearing for the last 2 days, you can't because, one, the FDA doesn't approve supplements, nor does it register supplements. Companies have to register, but not the products themselves, even though there are some listings of products, they're not registered. Good manufacturing practices, if you actually look at them, they can help, but they really don't include a lot of meat, a lot of teeth to them. They don't include contamination limits. They don't include ingredient identity parameters. They don't include testing methods, and as you know, as you've heard, you can use a very simple method and find that a product has 100% of what it claims, or you can use the right, rigorous method and find that it has very little or none. So manufacturers are the ones who get to determine these issues, these parameters. They are supposed to, follow, use good science behind them, but it is up to them. So you are trusting the manufacturer. In 2016, 62% of the audits that were done of manufacturing facilities failed to pass all the criteria. Typically, they, for the reason that they were not specifying or verifying the identity of ingredients. And you can actually link to there's a link there on our site. You can actually see which companies pass or fail that audit. We post that every year. We'll be doing that in about a month again for 2017. So what do? We do a lot of testing. We put out product reviews on nearly every category of supplements out there. About 10 to 40 products are included in each of those. We also have the oldest quality certification program. You may know that USP has one, NSF has one. We actually have the oldest, and it's actually the only one to freely publish our testing methods and criteria for passing. We do some specialty testing for academic researchers from time to time, really just to kind of help out. But really, our big push is really to inform the consumer and the healthcare provider as to really what's inside the bottle in these products. We also spend a lot of time looking at the clinical literature, because you can't just look, just at the product as was mentioned before. Ginkgo, we want to test the products, but we also want to tell our readers really what's the evidence for, against, what are the side effects, what are the drug interactions, as Bill was mentioning earlier. We also answer a lot of questions from consumers. We have over 500 questions answered on our website. It'd be hard to miss us if you have a question about supplements and we don't pop up on Google. We have an encyclopedia of natural products on the site, giving more clinical information. And also, I realize I forgot to have on here, but we also have our listing of recalls and warnings that come out every week, and that's an archive that goes back over a dozen years. And a newsletter that goes out to about 170, 190,000 people now twice a week with the latest updates. These are just some examples of the categories that we cover. Interestingly, this year we actually tested CBD supplements, even though they are technically illegal. They are being widely sold. We want to know what's in them. Apple cider vinegar, I'll talk about that. So it's not just the traditional fish oils and minerals and vitamins. We're looking at all kinds of things. We're going to be testing canned tuna fish and canned salmon shortly, just because the evidence for fish oil itself has waned, but the evidence for eating fish, just gets stronger. So we want to find products that actually have the omega-3s and are free of mercury, et cetera. So why do people care? Our members say, I need to understand which supplements are best quality. Physicians and dietitians tell us, I use your reports to help protect my patients. And even the industry, those who actually come to get products tested through us. And by the way, it doesn't protect them from us not being able to test their products, on our own, but it gives us an opportunity to increase the number of products, because our real goal is to find good products for people, who are looking to use them. So what does the industry say? This is a VP of marketing at a supplement distributor. We're an independent organization that consumers trust to help them choose quality vitamins and supplements. So what have we found? Well, 1 out of every 5 supplements that we've tested has been found to have been of poor quality. That's a little bit better than it was before. It had been 1 out of 4. It's nudging toward 1 out of 5. Herbals have the highest failure rate, 39%. Vitamins and minerals, 20%. Multivitamins, higher than that, though, because they're complex. Other supplements, 18%. And then other nutritionals, about 25%. So overall, it's about 22% of the products we've selected have failed testing. That's actually closer to 1 out of 5. So what do we find? We find too little or no ingredient in some products, too much ingredient, and I'll show you an example of that, where you're exceeding upper tolerable intake levels for certain nutrients. Inadequate labeling to describe ingredients, poor quality ingredients, spoilage of oils, contaminations with heavy metals, inadequate disintegration of pills, unapproved label claims. These are the kinds of things we're testing for. We actually do just a little bit of testing in-house for disintegration, making sure the pills break apart properly, but we have to do so many types of tests that we found it's better to use experts in different areas of testing. So if we get like a fish oil, it may go out to one lab for PCBs, another one for omega-3s, another one for heavy metals, et cetera. So we're coordinating a lot of testing as well as doing some testing. We select the products that we test for our reviews. We purchase multiple samples at retail. Products can never be sent to us. As I said, pill disintegration testing is done inside. Others are done out at other laboratories. We publish the results. All the results for the products that we buy and test on our own are published on our site for our members. As I mentioned, includes the latest clinical information, consumer tips, and we include in there any products that pass through our voluntary testing as well. We publish, as I said, all our methods. If you want to see how we tested and evaluated any product, anyone is welcome to click that link, and it'll show you how we test everything. And I wanted to show you an example from our multivitamin report. Again, for those of you who aren't familiar with what our reports look like and what we're providing here, so this is from last year. We do this report every 2 years on multivitamins. It's an extensive report. Summary, 46% of the multivitamins we tested failed. The biggest problem was actually with gummy vitamins. They are, as it was mentioned earlier, they are very difficult to make. I think it's very hard to control the quality in these. And I'll show you some examples of the kinds of problems that we're seeing with the gummies. We start off these reports with a lot of background about the clinical studies. Actually, Dr. Sasso's mentioned in his study with Centrum, as mentioned earlier, what we test for, what we found. We then move on to talk about, here's an example of disintegration. You can see how this product, even after 60 minutes, pills should break apart within 30 minutes. Even at 60 minutes, we gave it more time. It still didn't break apart completely. There should be nothing here at this point. Just as an example, we show our kind of top picks for different categories of supplements. But I want to get down to kind of the heart of our reports, which was really here, which is really what we show in terms of the results for each product, in terms of whether they were approved or not, based on how they fared in our testing. It doesn't mean they work or not. We have other information about really what you should look for in terms of whether something might work. But here we're just showing from a quality perspective whether it had what it claimed. And I'm going to shoot down to, as I said, it was actually, here's a gummy from Walgreens. It claimed 400 milligrams of folic acid. It had 757%. As some of you know, folic acid converts to folate at a higher rate than just the folate itself, so that it's actually equal to about 1,287 dietary folate equivalents. So you're going from what claimed to be 400, I may have said milligrams, micrograms, and we're finding 1,287. So we're finding 3 times as much, folate equivalents in this product. The upper limit is 1,000. So you're actually potentially doing yourself harm, by taking this multivitamin. Some more quick examples. And it's not every gummy where we find the problem, but here's another one, 174%. We found a number to be off on their vitamin A levels. This is a tablet that was off on its folic acid, and companies are allowed to, and they should put in a little more than is necessary to make sure that it lasts through the expiration date. But these are really, in our opinion, excessive. I'll just go through. And here's Vitafusion. I know we have a representative from that company. Again, way much more folic acid than claimed. So 1,382 dietary folate equivalents instead of, I believe, 400. Here's another one, Bayer. That one actually had what it claimed. So you can make a good gummy, but I think it's very difficult. I'm going to jump out of this and go back to the presentation. So some other interesting recent findings that was mentioned, Ginkgo biloba. So 4 out of the 10 supplements that we purchased off the shelf were found to be, only 4 were approved, 6 failed. They were basically adulterated. They were spiked with compounds from cheaper plants to make low-quality ginkgo appear to be high quality. And the way that herbal companies do this, herbal suppliers, is they can take a real herb, squeeze it out, basically, get a good extract from it, sell that, keep the junk that's left over. It's kind of like making coffee and selling the grounds and calling it coffee. They'll throw back in maybe one compound that they know a test is looking for. They're spiking it with that compound, and then it'll pass whatever that test is that's looking for that single compound. But if you're looking at the whole product, the whole array of compounds, it will fail testing, and that's what's going on with Ginkgo. One product actually had no more than 3% of the expected Ginkgo compounds. Apple cider vinegar, interestingly, all good news is all these vinegar bottles, these were all fine. They all had about 5% acetic acid plus compounds that indicated they were made from real apple. We also looked at these tablets that are being sold, because once something's out there, there's going to be a pill. So we looked at these, and what we found is that the amount of acetic acid, which is probably what's really making these products help people lose weight in a sense, is it's potentially upsetting their stomach with the acetic acid. They don't have as much of an appetite. And these pills have some acetic acid, but you really have no idea how much is in there. We found as little as 0.4% acetic acid to over 20%. Actually, based on just the amount of powder, it was about over 30%. Turns out that if you sell a consumer product, like a Drano, that has over 20% acetic acid, it's supposed to be labeled a poison. This product, was not. The company responded saying that, well, it's not a consumer product, it's a dietary supplement, it's exempt from that law. My reading of the law is actually that there's another place that says if you know there's a danger, you have to label it. In any event, they did come back and agree to change the labeling, to add that you shouldn't separate this product, this capsule, you should take it with a lot of water, take it with food. So it is nice to see that there is some improvement. In all of our reports, you will see at the top of every report, it'll state, the back and forth between these companies. So if they approach us, we will also offer to send it to another laboratory if they'd like to have it tested. Almost every time it comes back finding what we found. And it's not that the companies were really trying to do something bad. They often just didn't know what they were doing. Last slide, Golden Seal, talked about earlier. In terms of not actually being Golden Seal, you can see on the left, this is real Golden Seal. It has kind of a slight golden hue to it. This is another one saying it's a Golden Seal root powder. Definitely not. Didn't have any berberine in it, which is the key compound. It's not yellow. It would taste bitter, which it didn't. And so I could talk for a long time, but I'm going to stop. And again, if you put your name on that list, we'll sign you up for a membership to Consumer Lab for 3 months. Thank you.
So now I'm going to introduce James Hamblin, and we're going to do something just a little bit different with James's presentation. I'm going to ask him to kind of introduce himself and what he does, and then I'm going to interview him a little bit. We'll see how that goes. But James, would you please start?
Yeah, so I don't have formal remarks. I'm here representing all of journalism, the entire profession. But I want to represent that point of view, which is a broad one. I write for a general interest magazine that was founded in 1857. We cover the American idea. I came on to start the health section 6 years ago. I left a radiology residency, so I am an MD, and I constantly question that decision. But But it's been great, and the reason I did it was so that I could meet people and tell stories and constantly learn about the world. And the Atlantic's motto is that we are of no party or clique, and that was really important to me, that I not be tethered to any particular agenda or industry. I still have the physician's code to do no harm. I'm trying not to misinform people. But I'm not I'm not pro-regulation, anti-regulation, pro-big government, pro-supplement, anti-supplement. I can take each story as it comes and try to shine a spotlight where we need to, and to contextualize and to inform and to offer nuanced stories to our readers. So I'd like to be here to be part of the discussion to offer that perspective. And I'll talk with Paul now.
So why don't you come on and sit down, and I'm going to maybe encourage you to particularize some of the things that you just said. Why did we ask you here to represent journalism, which is essentially what you're doing?
Yeah, I think that there's a lot of misinformation on the internet, and if you're a clinician, a lot of people are coming to you having some idea of one thing that they read about one supplement, and they don't know if it's true, and when you trace it back, it can often come from a third party that is definitely not a disinterested party that is trying to sell the supplement, or from even a physician who's selling both books that purport to inform people on a new diet plan, and then also on their personal website selling supplements that are recommended in the book. So it's really important that journalism exists as an institution where that no one, if you're seeing this on the Atlantic, on the New York Times, Wall Street Journal, you're reading this from someone who is not also taking money from any of the interested parties and is doing their best to simply cut through it all. And as there gets to be more and more nonsense on the internet, you can at least go to these places and not trust everything that you read blindly, but have a much higher threshold for thinking this is probably accurate. This person has probably, in good faith, tried to give me the best information that they could.
So what have you written about supplements that
You
people...
name it. I've written so much, and I guess sort of there's a couple interesting things to know. So like I said, I started the health section, so I was covering everything that had to do with health. We moved very quickly. Like when you're working with journalists, if you want to be involved, be interviewed, make contact information readily available, make as much information available as you can, make yourself accessible, because people move real quickly and they're often working way out of their depth. I mean, there's something good to reading a story by a journalist about caffeine supplements when that journalist is coming into this fresh and they don't really have a lot of background with caffeine supplements. So they're going to come, they're going to talk to people, they're going to make sense of it. This is a smart person who knows about science, and you're going to read their takeaway. There's something nice about that, as opposed to getting a story from someone who's been covering the industry for 20 years and it has lots of biases and kind of probably didn't have that. But at the same time, that means that journalist who's coming in fresh probably has a few hours to talk to as many people and learn as much about this as they can, especially if it's a news story. So everything's not always going to be perfect. But the more that all of you can make yourselves available and be part of the conversation, the better. And then, to that end, I've written about pretty much almost every kind of supplement. Lots about caffeine, lots about vitamins, melatonin.
So tell me, you mentioned caffeine a couple of times. What were you trying to learn? What were you trying to convey to people about caffeine-containing dietary supplements?
There have been a few different stories. I wrote that there's a company that was selling topical caffeine sprays that interested people for a while. So kind of when there's a new product or there's something that people are talking about, I'll try to cut through how much of this is accurate, how much of it is not. And I don't know, there have been multiple different sort of takes on it, I guess. Caffeine is something that fascinates people because to so many people it's totally fine when you drink it in coffee. In fact, it's almost weird if you don't like drinking coffee. And then it becomes very weird if you're spraying caffeine on your skin. And even weirder if you're spraying it at other people. And then just thinking about why that distinction should be, and then why you should be thinking about one thing that is a supplement, which is a stimulant, which can have serious effects, and why we regulate that as not pharmaceutical.
So this is, it's obviously come up a few times, I think. I don't know whether it was covered earlier, but I did come in during Patty Doister's presentation, and you expressed concern about the levels of caffeine exposure that warriors and their families are likely to be engaged in. So there have been regulatory efforts. So what was your take on it? Was it that you were concerned about the health of people, that they were not paying attention to the signals? Was there some other aspect of this that got your attention?
I think it's really easy in a meeting of people who think about this stuff as much as all of you do to forget about the average level of literacy around supplements, and I'm constantly confronted with that, and readers write to me all the time, and that does inform my work. And a lot of people just have no idea that anything they're buying from the store could be potentially less than 100% exactly what it's labeled to be, and that it won't definitely do exactly what the label implies that it will do. And just constantly reminding people of that, and then the duality of, when people buy something, when they need a prescription for it, they tend to take that very seriously and follow the label to the T. And when it's something you can buy as much of as you want, there seems to be no reason to not take as much as you want. And so just reminding people that this is not necessarily pure, it's not necessarily good for you, and you can overdo it more is not necessarily better. Those are probably three themes that people seem to want and need to be told again and again about different supplements.
So do you, you're kind of leading to something that I was going to ask you about. You get reactions to your stories, and does that lead to a conversation with readers?
I wish it was more interactive. I mean, you sort of use social media to try to make it not feel like you're just proclaiming things to people or decreeing, so we were talking about this earlier, there's a lot of mistrust of journalists right now, like 12% of Americans trust the media, which is a term I don't like, but the one group of people who've made it their job to just simply try to discern truth and convey it to people are very mistrusted right now, and part of that is this sort of elitism of just seeming like we know exactly how the world is and is supposed to be, and I get that, so I try to be interactive with people and be open-minded and say what we know and say what we don't know, and not try to be talking down to people as the definitive source on exactly how much vitamin D they should be taking, or but at the same time not leaving it up to people to, not implying that we don't know anything.
So do you feel you've learned a lot from
Oh, yeah.
having,
No, I mean, I'm in it because I want to just keep learning.
What are the big messages for somebody like you?
Of health, of communicating around?
Sure, and
yeah.
Of course I'm interested in the supplement component.
Sure,
of what-
sure.
Yeah.
It's, so people, I mean, so many, I think people are really, really drawn to supplements because they offer something that is, it helps them feel control. Most health solutions are about control and making sense of something that doesn't make sense to you, especially when it's a serious diagnosis. It's very rare that someone can be diagnosed with a cancer and they can say, oh yeah, well that makes sense, that would happen to me. And then you're just grasping for solutions, and the medical establishment tends to be really rational about saying, okay, we can give you this chemotherapeutic agent, there's a 70% chance it will increase your lifespan by this many years, and you'll have these side effects. And then you can also go to the store and have something, or read something on some blog about something that seems just absolutely perfect, like almost no side effects, relatively cheap, and it cured this one person's kid. So they offer that sort of, even to rational people who are science-minded, to just say, yeah, I mean, why would I not at least try it? So I don't know, I guess I think a lot about the appeal of that, and then how to not rob people of that effect by debunking it, because I think there's value in that, but then also accurately telling people you're probably wasting your money, you're possibly hurting yourself, and you're possibly misfocusing your energy on something that is nonsense, as opposed to emphasizing the things we do know that could be helping you.
You used an interesting word there that I think we've used in our own thinking about how consumers approach dietary supplements. It's to take a little more active control of their own health. Sometimes it's in the context of maintaining health. And that's a somewhat different circumstance from somebody who is seeking remediation of, you used a potentially, very strong, a poor outlook for in a disease state that's not going to get any better by itself. Right. My words to convey what you said. But for the most part, it's consumers who are seeking health that are taking dietary supplements. That's not everybody. Yeah. We know there's no everybody in here. But for those who are taking dietary supplements as part of a healthy pattern of health-seeking behaviors, do you see them as a different kind of audience from the ones that you just described, where they're maybe actively seeking solutions to acute problems?
Yeah, I think, and that's probably most people who are going and reading New York Times, general interest magazines about the latest supplements and whether they should be taking a multivitamin and whether something is going to be, helping them prevent a heart attack later on. You're not getting as many people who are reading about their specific condition. And that's part of the thing about a general interest magazine. You want things that are going to be interested in most people, not just to people with polycystic kidney disease. So that's who we end up writing to most of the time. And you could almost break it down further, right? Like people who are just hoping to maintain the status quo, and then people who are trying to improve themselves, like in the case of military uses. Those are all supplements that are actually making you better at performing, or promising to make you better at performing. And yeah, to the simple idea of maintaining the status quo, it's again very easy to sell people on the idea that it's harmless. You're not spending a ton of money. Worst case scenario, you're flushing some vitamins down the toilet. And I also like to remind, I like the psychology that we are always making trade-offs and that we're justifying things to ourselves, and that when we do take a multivitamin, it likely changes our calculus on how healthy we need to be in the rest of our lives. And this is mostly, I don't have a study off the top of my head, but I have a lot of anecdotes of people who will think they can take a multivitamin and eat pizza. And if they didn't have that multivitamin, they might have ordered something healthier. And so we're not exactly comparing the exact same life plus or minus a multivitamin. It's how does that change the psychology of the user?
That's a reasonable thing to say. I'm looking at the clock only because I have a feeling that you may have stimulated some thoughts in our
Oh yeah,
audience.
I'd love to talk about whatever anybody's curious about journalism.
So what I'm going to do now is invite all three of the panelists from this session, Laura McCleary, Todd Cooperman, and you, to hang out here and take some questions from people in the audience, and then we will end the day by having all six of you join us up front here and engage in further discussion. So thanks a lot, James. So we have an opportunity to talk to these folks. First, I see Duffy in the back with a question.
Yeah, I'm just from the media perspective, I'm always curious. We do our advertising review and we try to self-police there. And it's often shocking at reputable organizations will take terrible advertising that's just clearly with claims that are too good to be true, promising things that could not be substantiated. I'm just wondering, do any of these newspapers, do you ever hear them having policies in place that says, we should not just take these people's money, we should vet the claims a little bit?
Yeah, so the critical thing about, you guys probably mostly know this, but the structure of any journalistic media organization is going to be such that there's a thick firewall. We do not even share any of the same space with people who have anything to do with advertising. So no journalist has any say in any of the ads that go into our magazine or onto our website. If we see something that seems particularly egregious, we're welcome to file a complaint or send it over to but it's a completely separate area of the business, and it's meant to be that way. And I know that they, within Atlantic Media, they have standards and don't want to be misinforming people with any ad content. I don't know exactly how those calculations are made at other places. We certainly wouldn't run an ad that seemed to be, doing harm for the world. But I guess the important takeaway is that I have nothing to do with that, and no journalist does. And a lot of people think or don't understand that that's the case.
Other questions from the audience, or perhaps do you have questions for one another on the panel? There's a lady in the back here, all the way in the back, yes? And then the lady in front of you.
This question is also for James. What kind of sources do you use? Do you use like responsible journalism, like our PubMed and CINAHL for some of your sources when you're doing a story, or do you, what kind of sources do you use?
Yeah, I'm certainly not irresponsible sources. So I just finished up my MPH actually, so now I feel like really good at vetting methodology. And statistics. I have statisticians on call who I'll try to vet studies for. I'll try to, I have higher thresholds for going for studies that are in bigger journals, but I've seen terrible stuff published in JAMA and the New England Journal, and you just try to, I have a network of people who I'll send it to and be like, do you have any time to look at the methodology on this? Like, because probably I'm going to write something in a day, and the people who can give me a comment are not always going to be available, or always going to feel like they can really dig into this study in order to say whether it's good or not. So thankfully, I'm able to do a lot of that myself. And then the longer reported things, you dig into, I'll spend a lot of time getting to know one particular source and then find that they got all of their funding, on this study on biotin from the Egg Council, and like that's going to cause a lot of problems. And so it's not just about whether someone seems they know what they're talking about, but where's their funding coming from, and how is that going to appear to a reader? It's extremely complicated, but the longer you're in journalism, the more you get a good sense of who's trying to sell something and who's just trying to do science.
Good. One more thing.
Oh.
Do you usually put in like recommended dosages that like the American Heart Association or the FDA would recommend for a specific dietary supplement in your articles?
It'd probably be a little too granular.
Okay, thank you.
Yeah.
There was another lady on the right-hand side, and then Naresh.
Hi, I'm a psychiatric nurse practitioner, and what drove me here was my patients asking questions, and like y'all have mentioned, I have no idea how to answer them. But also, what you mentioned, Dr. Hamblin, that I've had supplement companies approach me to sell their products online, and it seems unethical to do that. I'm glad to have these third-party organizations like Consumer Lab that I can now refer patients to. But is there any ethical implication or legal implication for providers selling supplements?
Do you have any thoughts about that, folks?
It's regulated by your state medical board, and it's different state to state.
But do you have
I
any?
mean, as a person I would just find it, anyone who's recommending something that they're also selling, it's just really hard. It's like, not like your car salesman can't be honestly giving you information about that car, but I wouldn't trust them as the definitive source on making, are they really telling you everything that you need to know? I would definitely, go talk to other car dealers at other places and read consumer reports and find, more objective outlets before taking the recommendation of someone who's also selling the product. Not to say it can't happen symbiotically.
Laura?
Well, so, there is a legitimate role for medical providers that are truly informed about the efficacy research and the risks and medical counterindications, right? To know about dietary supplements and to be able to inform their patients. I think trainings like this are great for filling in some of those gaps, but to become a full expert on, everything the patient might ask you would be a big job. And I think that level of medical knowledge varies widely among providers. That's one end of the spectrum. Someone trying to provide legitimate medical advice, is it worth it to spend your money on a probiotic for this medical condition? For example, to mention something we've done some research on, for vaginosis, like there are some strains that might be helpful, but in general, probably not worth your time and money as a sort of dietary daily habit. More troublingly, there are so many examples of diet books or doctors who are also essentially running a supplement company and selling their name as part of that. There's one that hits my Facebook feed with real regularity, and the nutrition advice is wackadoo, and the supplements are like the third thing that they're selling you. There's one that we're looking into right now where there's a guy who runs a gambling hotline and basically does telecounseling for gambling addicts, and then also sells a line of supplements that are supposed to help you stop gambling. So it's snake oil, right? It's chicanery and that sort of thing has been going on for a long time. And it's just unfortunate that those kinds of practices are allowed to persist by a very loosey-goosey kind of regulatory infrastructure. So
I bet that could-
I think there's a range of things, and I think for that latter category, there are real ethical questions about whether the medical advice that they're providing to their sensible patients is in conflict with their licensing obligations.
Todd, did you have any comments about this part of it? And others, turn off your microphones. Thank you.
Yeah, not in terms of the legality of selling it. I defer to more experts on the law there, but we do test those brands also, the professional brands. They do tend to be higher quality, not guaranteed though. We do find problems from time to time. They are a lot more expensive also. So I mean, as a physician, I think it'd be better just to recommend something that you know is good and inexpensive, than something that might be good and expensive. So that's just my 2 cents on that. I would say also the multi-level marketing companies that are out there, the Nutrilite, Amway, USANA, similar, the products tend to be higher quality there, but also just a lot more expensive.
Naresh?
Dr. Hamblin, you look young, MD. Are you taking any supplements?
I wondered when a question like that might come.
I'm 35 actually.
Okay.
I don't take any myself, but I'm fortunate to have access to a good food system.
Mm-hmm. Good answer. Yes, next to Naresh, yeah.
So this question is for Dr. Hamblin. So I was raised in an area where people don't really trust science very much, and so I get a lot of questions when I go back to visit my family about why science keeps changing. Like they read coffee's good for you, one day coffee's bad for you, another day. And as a researcher, I understand why that happens, but what do you think the role of the journalist is in trying to put the information that they're communicating in terms of the whole picture of what's been happening in the past in research?
This is like my favorite question. I've written about this a few times. One story called "New Nutrition Study Changes Nothing," which kind of gets into this like extensively. But there's the problem of the news cycle. Everyone wants something new. Everyone wants to be talking about whatever the thing is today, and the editors and writers have to come in and have something new. And a good story is something that changes your perspective, right? That challenges what you already thought. Like no one needs to be told, again, also probably drinking water is better than drinking soda yet again today. Right? We need something new. And the news story would be, drinking soda, not as bad as you thought. Like, maybe you don't need to be running. Like, that is something that's engaged. That's just a good story. That's interesting. So how do you square that with actually being the fact that science moves like this, like there's slow twists and turns to it, but not something that's going to engage like the whole big general interest audience. So you can find lots of other ways to make stories interesting and good than trying to completely change someone's worldview, which is to highlight an element of it that people don't know enough about, trying to highlight like the personal stories behind it, trying to make it funny or entertaining in a way that's not necessarily like over-promising or scaring people, and definitely not misinforming. And I could go on and on, but that's just like a main job of what I think. The main thing that I think about our job as being is contextualizing. Is like, I'm going to tell you about this new study that everyone's talking about today, and I'm going to put it in the context of 30 years of knowledge which have been building to this point, and so this is not taken in isolation.
Other questions? Mary, you had your...
I have my microphone on. This is a good lead-in to something that I find challenging as both a performer of research, as a provider counseling patients, and as a person making my own individual choices. It seems to me that there's a taxonomy, or what I could describe as the typical arc of a story for a dietary supplement. And the first time it comes up, it's terrible, it's wonderful, brilliant. You'll find people who are cured of something. Then the look for a new story is, after that's not a new story anymore, then you start to see the negative stories come. It's caused this much harm, it's terrible. And so I guess what I'm asking about is this bias or over-interpreting, both in the positive side, but also in the negative side. And I published something in the in the JAMA years ago, and when we looked at the consumer extract from our study, it left out a huge part of our results. It only wanted to talk about the negative results. And I'm finding that challenging, that the assessment of risk is risk versus benefit, risk versus opportunity, personal choice. How would you address that, all of you, in the work that you're doing? Keeping both ends of the spectrum alive without over-exaggerating either one.
So this issue that's a wonkier version of the last question in a way. It's sort of, and I think it comes up with dietary supplements. As I said, there's a lot of magical thinking. People want to believe that the cinnamon that tastes good on their Pop-Tart is actually doing something really beneficial for their health. But it also is magical. There's a lot of magical thinking in nutrition, right? So there's all these trends and diet fads, and also thinking, and really, as Dr. Hamblin implies, dietary advice hasn't changed much in the last 40 years. It's basically, eat more vegetables, eat more whole grains, don't avoid salt, sugar, and saturated fat. And you've had a fight maybe over defining fat more precisely, but there isn't sort of there's a lot of savvy among brands and among food manufacturers and among dietary supplement manufacturers about how to create that kind of mental permission for someone to go and take something that's just a little bit better for them and think of it as a health food. So, the example that I always use is veggie sticks. So you have these little potato sticks, and now when I go out to birthday parties for my 7-year-old, they'll show up at the party because they wouldn't put a bowl of potato chips there, but there's like a picture of spinach on the front of the package, and there's like a dusting of spinach, and they're sort of greenish. So now everyone can eat the veggie sticks. And it's because we want to eat the potato chips, but we want to also feel healthy. And so there's a brilliant sort of exploitation of that. And then there's the rebound effect that was talked about, whereas, you eat something healthy and you think, oh, I could indulge a little bit more. So if I have my multivitamin, how does that affect my overall diet quality?
This might, I'm sorry to interrupt you, but this might carry over a little bit into our broader discussion. So what I'd like to do at this point is to thank and congratulate our speakers from this panel, and then invite our other panelists from the previous session to come on up, and we'll re-engage in some more discussion. Thank you.